You know, my wife's from Nebraska, and we spent a lot of time out here with our family on vacation trips, and I grew to like the area, like the people, and when I had a chance to interview for the job, it looked like just the right fit for me. I was able to get to know people. They wanted to know, about you at the same time, so it was a caring community. I think a lot of the self-satisfaction, at least for me, to be an athletic director, is seeing the success of the student athletes and just all the award winners, the people competing for national championships, getting their degrees, winning the special academic awards. Seeing them have success drives me. Started out with a simple tremor in my hand, right arm, and started having anxiety attacks when I was in public speaking settings, which for me had become, easy things over the years and pretty common. But I started having anxiety attacks and couldn't catch my breath, and when I was in public settings. So something wasn't quite right. So I went and talked to the doctor, and he wanted me to get to a neurologist and have a battery of tests done to make sure to eliminate some things like strokes and Alzheimer's and other possibilities. One thing that wasn't eliminated was Parkinson's.
Parkinson's disease is an illness that has very many causes. It's not just one thing. And it affects the motor system or muscle movement. In some cases, we know what the cause is. We know, for instance, there are several genes that by themselves can cause this condition. And that there are some things in the environment that we know possibly can cause it. But for the most part, we don't have a real good grip on the causes.
It's a learning process for everybody involved in it, doctors included, as they work through it, because it's different with each person that has Parkinson's. That's what I found out. I mean, no two are the same. It's about like a snowflake. Really, no one knows where it really comes from. So they're still trying to figure out a lot of that, and that's why, as much as I can, I'd like to educate people about Parkinson's and what people are dealing with when they have Parkinson's. It's an interesting animal, and it definitely changes one's life.
We can walk and chew gum, we can walk and talk at the same time, so we put it on automatic pilot. We don't really think about how to get up from a chair, we just do it. These programs we learn within the first year or two of life, it seems like they're wearing out, that the program for these kind of complex movements, imagine if you had to write the program for rolling over in bed. There has to be at least 50 steps, and if you don't know how to get going, if those programs don't work, you've got to find out how to take that first step and how to take the second one and how to make a turn. And these things are not easy. They're so easy for us, we take it for granted, but it's not easy for people with Parkinson's.
I've joked a few times with Dr. Bertoni in Omaha that I'm tired of thinking. You just constantly have to think about everything you're going to do. You have to refigure everything in your brain. And at age 57, that's not the greatest time in life to tell yourself to do all these things, because staying active at 57 is difficult enough without Parkinson's. And the combination is a double whammy. One thing that the doctors and the physical therapists have stressed with me is they're trying to help as much as they can in clearing my mind as much as they can, and make me concentrate on things that can be beneficial for me, and get rid of things that aren't beneficial and the worries in my mind. So that's what led to the decision to step away from the athletic director's position. Dealing with people that are very close to you it was the most incredibly difficult discussion that I've ever had to deal with. And besides family, those are as close as people have been, to me. And it was real tough because I'm not real good about not finishing something. That drives me crazy. So to have to step away before I'm ready to step away is an incredibly difficult decision. To admit you can't do some things that's challenging and can get you down a little bit. But you just have to stay positive, stay focused. If you have people reminding you of that, maybe it's your wife, maybe it's your son or your daughter, or maybe it's a physical therapist that keeps nudging you along, you can do it. I can be positive, but I need positive people around me too.
Like any time we have an illness and we get a diagnosis, it is such a change, and there's a lot of fear, of course, but the challenges are acceptance and a certain willpower that you're not going to let, you may have this illness, but you're not going to let the illness have you.
I guess there's two ways to go. I'm a glass is half full person, and so I'm going to continue that process. I'm going to fight it. When they talk to you about it, there's not a cure for it, so you know what you're dealing with the rest of your life, and that's what you have to, as in a mindset, you have to prepare yourself for the fight the rest of your life. I'm going to have to do PT, I'm going to have to do stretching, I'm going to have to continue to do that, or I'll lose those capabilities if I don't take care of it, if I don't fight the fight.
The number one key to success for Jon, and we see this across the board with all of our patients, but it's really been a testament to who he is and his spirit, is his drive. His attitude towards this whole thing has lined up really lockstep with us, which is let's push, let's see what we can achieve, let's push for that next step, let's push for that next thing to be able to attain. That shows a lot of character, that shows a lot of determination to really push through beyond what a diagnosis tells you.
I wish we could clone his attitude, because a lot of people want to retreat and they're afraid of so many things, but he's courageous and more power to him. That's the kind of thing that we need to show people, that you can fight this and you're not all alone in fighting it.
I think that's why I was interested in helping with the educational aspect of the Parkinson's group in Nebraska and getting the word out to people and getting support groups started and those type of things. Just knowing that someone cares about it and wants to understand that they've helped out and they ask you what they can do for you, that means a lot. The support people, the medical people, the people that have Parkinson's, as much as they can share about their cases with people and how they best effectively handle those cases, the better off everybody is in the process. Until you get in that situation, I think you don't recognize that.
People need to understand that this is a common condition. In this area, maybe somewhere between 3 and 5% of men will have a chance lifelong, that is if they live long enough, to have Parkinson's disease. It is too common, and anytime anyone suffers from this disease, it is not a good thing. We should try to eliminate the illness, and there are research programs that are looking to do that, but we need to know so much more.
As they keep working on Parkinson's, maybe they do find that right drug. Maybe the medication will do it. Maybe the exercise will be the common element in all of it too. If I can help along the way in letting a doctor find certain combinations of medicine and physical therapy that work, and so be it. Play my small role, and if it helps somebody down the road, that's one of my personal goals. Whatever thing I can do to help moving forward, I think that's important at this point. And if I can help somebody get better in the situation and better understand Parkinson's and know how to deal with it, then I'll feel successful in what I've done with it.
We need more people with the same attitude Jon McBride has. He's a fighter, and he's going to fight this, and we're going to be there with him.